This conference will now be recorded.
Hey everybody, this is Jennifer Harris with Healthy St. Lucie in the Florida Department of Health in St. Lucie County, and I'm so excited you're able to join us this morning for the Art of Healthy Living, a fall webinar series that we're hosting through Healthy St. Lucie, and it's brought to you by PCA, Primary Care Associates, and Humana. So we're so excited you're able to join today. I just wanted to do a couple little reminders at the beginning of the call. If you are joining us as part of your wellness program at your work site, if you can go ahead and enter your name and organization into the chat box, that'll help us, especially Port St. Lucie. I know that they're promoting this among their employees so that you can get credit for your attendance here and go to your wellness program. We would love that. We're also recording these webinars and going to put them on the Healthy St. Lucie website so that you can watch them on demand or share with your friends and family as well. So just wanted to let you know that we are recording today. So we're really excited about the topic today, clean eating. We know it's hard, but when we look at all of the other stuff that we eat throughout the day and the week, it's really important to kind of look at how healthy are we eating, and are we eating clean and getting the nutrition that we need throughout the week, or are we supplementing that and eating too much processed food. So this is a great topic for us today. We're really excited to have primary care associates here to talk to us about that. So what is Healthy St. Lucie for anyone just joining us today? Healthy St. Lucie is a coalition promoting health where we live, learn, work, and play. We have about 35 organization members across the county. They came together in 2015 when we were completing a community health assessment. And from that assessment, they came together to decide how are we going to improve some of these items we found in that, and then they worked to develop a community health improvement plan. So in that community health improvement plan that we're currently working on right now, these are just kind of the focus areas that we are working on right now. So we are working on getting people to eat healthier. And we've got two main goals with that. We're looking at increasing breastfeeding initiation among moms and the duration of breastfeeding at least 6 months or more. And then we're also working on getting people to increase their intake of fruits and vegetables, which was identified as a big issue in our community, especially among adults. So we have a lot of different projects going on in the community, in schools, work sites, the community, trying to increase fresh fruits and vegetables. For our breastfeeding initiatives, we're working with the hospitals, doctors' offices, and then the community as well, trying to increase initiation and duration of breastfeeding. We also have a food council working to look at where we have food deserts in our community and improve those. And then on to our next focus area, which is getting people to move more. We identified that people, and especially adults in St. Lucie County, are not meeting the national recommendations for physical activity. So to that end, the coalition came up with a community-wide activity challenge called the Billion Steps Challenge, where we're working as a community to get 1 billion steps together each year on a platform called Walker Tracker. So we sync our smartphones, our Fitbits and Garmins, or you could actually manually enter into that platform and you can record your activity towards our challenge. So we're in our 3rd year for that and looking forward to a 4th year coming up. But we do work on implementing and promoting this in our schools, our work sites, and our community, getting more people to sign up and get moving more and commit to an active lifestyle. And then finally, we're working on getting people to feel better. So we have projects that are working on preventing chronic disease, but also managing them better if people do have chronic diseases. We have diabetes support group, and I'm very happy to announce that we got some additional funding. We're going to be working on diabetes prevention program coming up soon as well. We also have tobacco prevention and cessation programs around the community, and we are working with an age-friendly community, a collaborative as well. So we're really excited about those efforts, and we'd love for you to join us as we work in the next few months to finish out our new community health improvement plan that will launch January in 2021. So feel free to email me or Stephanie Myers if you're interested in taking part in helping form that new plan. We would love your input on that and look forward to emails on that coming up. So again, we're really excited about this topic about clean eating. And, you know, if we do work on ditching that processed food, we know you're going to have more room on your plate for fresh fruits and vegetables, which is one of our goals in our community health improvement plan. So I'd like to go ahead and turn it over to our presenter for today, which is Dr. Bizanti from Primary Care Associates. Dr. Bizanti.
Hi, thank you so much. I was trying to find the unmute button. Great. Today we're excited. I'm working with Primary Care Associates, and should I share my screen or?
Can you see it? Do you want to share your screen instead, or can you see my?
Can you share? Are you sharing it?
Yeah, is it not showing up? I've got it on the slide of meet your presenter. Can everyone else see? Let me check this. I might have. Was my screen not sharing the whole time? How about now?
Perfect. Yeah, I can see it now. Awesome. Thank you so much. So, yeah, a little bit about myself. I work at Primary Care Associates, where I graduated from Libya, North Africa, came here, did my board exams, and started focusing on how can we provide this primary care initiative in terms of preventative care, in terms of care for patients, and how can we kind of focus on implementing the care management for reduction of hospitalizations and readmissions and ER visits. Worked on a few other projects, and I think this is actually something that goes key to everyday advice that we give to patients. Diet and exercise are the two most common and very important advice that we give to patients every single day to manage most of the chronic conditions today. And today is going to be a very hot topic, hot button, and not only because it's diet and nutrition, but it's also because of during what's going on right now with the pandemic, what you eat during your, while you're staying safe at home, and everything is key important to keeping that healthy lifestyle balance. Yeah. So thank you very much for that introduction. Yeah, just a few things to remember. I know this is housekeeping kind of stuff. Yeah, so you guys got it. You guys know it. It's amazing. It's just, and if you want, please don't be shy to ask any questions in the middle. Don't hesitate, jump in. Jennifer likes that interaction. We all love that interaction. We want to hear from you guys, We'll throw out some random questions in the middle. If you do, please let us know. I would like to hear from you. I would like to learn from you. And we'd like to all learn from each other. So keep side conversation class. Okay. Awesome. A little bit about our agenda today. We're going to talk about four main topics all about clean eating. We're going to go into the problem of why processed food is not optimum and how can we moderate that. Simple steps to help you clean your diet. So what are the steps? We're going to go over that as well. And lastly, we're going to try to go over healthy habits to help you feel your best. So what are the tips and tricks that we can provide in those topics? Okay, so what is clean eating? When you hear the term clean eating, what does that mean? What does that ring a bell to you? Is it active washing foods before you eat them? Do you wash them properly? Eating only after you have taken a bath or shower? Or is it making food choices that are centered around the unprocessed and whole foods and clean foods? So clean eating doesn't actually have an official definition. Even if you try to define it, there is no. It's kind of like a term that was used actually to interpret many things of what it means to eat clean. However, its name implies that it's an approach to eating about cleaning up your diet away from all the junk foods, all the sugars, the sodium, all the extra foods that we don't want our body to take in, and we don't want to put in our body that's might not be beneficial for us, medically speaking, right? So the clean eating, it's a movement, and it has deep roots. Despite its recent popularity, and everyone's talking about it now, and it's a trend and it's a hashtag, it can be also linked back to the way back in 1960s, where they started growing the organic food. Organic food started then, and it became a movement, and it's very popular. Whole Foods is big about it. So is Amazon after they bought it. So really, really big on organic food marketing. The clean eating is also an approach that provides well-grounded nutrition principles in its unstructured way that allows for freedom and flexibility. Essentially, what all that means is it focuses on choosing whole foods rather than processed foods. So the foods right out, when they come out of that sand and they pick it up and the farmers get it, that's what we're looking at. That's what we're going to talk about in terms of having additives that added to it versus those kind of. So generally speaking, processed foods comes in a box, a bag, or a can, or a package. So those are processed foods. Anything that comes prepared, has preparations in it, or has preservatives. We'll talk about the advantage and disadvantage of those foods in a moment. Eating whole food and minimally processing foods, yeah, falls really, really good. So let's take a moment and go through it. So what are processed foods? Just like we talked about, so according to the Academy of Nutrition and Dietetics, the terms processed food refers to any food that has been purposely changed in some way prior to being consumed. So if there's any additive or anything that changed to that food, then they consider it processed. This includes foods that has already been cooked prior to eating it, canned, frozen food, or packaged. It also includes food that has been changed nutritionally. This could be through either adding vitamins, minerals, preservatives, and to help these foods be fresh for a longer duration. Those are the additives those are sort of preparations of the food that when you taste them, their texture, their taste might differ from how it actually is if it's organically or if it's without adding any salt or artificial colors or all those additives on it. So let me ask you a question here. Is it true or false? Here we want the interaction. You can unmute yourself, jump in, scream. There's a chat text there as well. So true or false? All processed foods are unhealthy. Yeah. What do you think? Is all processed food unhealthy, or is there processed food that this is great? Yeah. What do you guys think?
That's a false statement.
We got some chats. We got some.
Yeah.
All fixed, false. Yep, false. You're right. Emily, Kimberly, you're right. So the correct answer is false. Processed foods can still be healthy. Edgar, yes. So it also can be healthy, but it often depends on the degree of which they have been processed. So what degree have they actually added to it to change that nutritional value, to change that, the content of the food or nutrition. However, yes, there is a lot of, so I'm not saying everything in can, everything in a package is bad. We're not saying that at all. Would OG be in this category? Orange juice, good question. Orange juice has a lot of vitamin C. There's a lot of different types of orange juices too. Even in the market itself, there's so many brands, so many versions of it. There's some that are more closer to fresh versus there are some that's so much sugary added in it, sweets and colors, and so that depends. I can't say OGs, here's one thing and I could mark it. It depends on the additive and percentage of those sugar, and you have to look at that nutritional value, and that nutritional value will tell you what exactly you're looking for in terms of, I want this, I want the vitamin C, I want the taste, I want the color. So another thing, the Academy of Nutrition and Dietitian also says that processed food falls on a spectrum of minimally processed, like a bag of spinach or salad mixes, pre-cut vegetables, roasted nuts, frozen fruit, or bag dry beans. All those are not heavily processed, but unlike frozen dinners, like frozen pizzas or microwavable dinners. So those two different kind of categories here, when we differentiate them, bag of spinach or vegetables versus a frozen pizza and a frozen dinner. That's what we're talking about. So some processed foods here are simply pre-prepared and packaged for convenience, especially during now. We don't like to cook. If we're like, just relaxing, just pull that out of the freeze, throw it in the microwave. 3 minutes later, you're having your dinner, you're amazing. Then we have to think of the vitamins, the minerals that we're putting in, the nutrients like calcium, vitamin D, fiber. Moreover, some minimally processed foods like pre-cut fruits and vegetables can be great alternative for busy people. And frozen fruits and vegetables are also available around the year, and their cost is also less than fresh versions. So sometimes avoiding certain food and avoiding all processed food is not realistically for many people, especially in today's world when we're all kind of dependent on those easy fixes, quick, dinners. Yeah. So the key here is to limit heavily processed foods. Not every processed foods, but just the heavily processed foods, where the Academy of Nutrition again says that a good way to differentiate is to remember that heavily processed food can be recognized as food not in its original form, or food that it's not naturally occurring at all, such as soda, donuts, and cookies. Those are just a few to mention. Yeah, let's go next. Thank you, Jennifer. So what types of things are actually added to foods? There's many ingredients that could be added to food nowadays. A lot of them could be to make them look better. Sometimes, to make that color, stand out, or maybe to taste a little bit better. Some of them is to boost the nutritional value or food that make the food last longer. Preservatives, Here's another question for you, by the way, true or false, really quick. Additives, Dorothy, what about tea? Tea is good. I don't see it. Is tea preservative? Oh, you're talking about I thought the tea bags that you put in the water. It depends. So there's teas, we look at the sugar content in there as well. I think that's the most worrisome. Sugar, preservatives, minimally processed, yes, minimally processed. So let's go to the next question, true or false? Additives and preservatives only started to be added to food recently, so just in the last century or so. When do you think they started adding preservatives to food?
Millennia.
When? Millennia?
Yeah, salt is a preservative. Is that correct?
Interesting. Yeah. False. Everyone's saying false. Kimberly, Dorothy. I like these guys. So we're getting more engagement on the chat. Yes, you're right. So it's not recent. It's been years. Actually, if you go way back, the fishermen's, right? They used to get their fish, but how do they save it? They used to put salt on their fish to keep it lasting, because if they didn't have freezers back in the days, they used to save everything using salt. They used to even, way back, we're talking over hundreds of years, even the meat when they hunt back in the days, they used to put preservatives on there, but they used to put salt and they used to put it in the sun to dry it out. And that dry salted food, that's the preservatives that they could keep meats for the whole winter when they can't hunt. And, if you go back all the way in history, but yes, it's something really ancient. What they've been using is even herbs and spices. They used to improve the flavor of the foods. And fruits have been preserved also with sugar as well. So today, the FDA maintains a list of over 3,000 ingredients added to foods in its database. 3,000. I mean, if I say salt, that's only one. Sugar, that's two. There's 2,998 more that FDA counts, So there's so much preservatives in their database that all food additives are carefully regulated also by the Food and Drug Administration and other international organizations to ensure that foods are safe to eat and accurately labeled. There's a handout that we can find a list of various ingredients that are added to foods, what they do, the types of food they're added to, and the names they can be found under a product label. So if you're looking at a tuna can, or what are we going to look for specifically? What are we going to look in tomato cans and this and that? So you may also hear about GMOs. GMOs, that's a very common thing now. It's a common, it's going out really. GMO stands for genetically modified organisms. So that's the label of it, genetically modified organisms. These are created by changing the genetic genetic makeup of a plant or an animal in ways that could never occur naturally. So it has to be humanly genetically modified to make it effective. People are, and because the ability to, and so GMO is also relatively new. It's really came out really recently. So naturally, people are concerned over their safety. But according to the Purdue University, GMOs have been extensively studied, and there is no evidence that suggests that eating them could cause any harms to humans. So sometimes we usually look at non-GMO food. However, it has been recently studied, but not over long term, not over long years to look at the long-term effect yet. However, the studies that shown as of today say that they don't cause any harm to humans, which is a good thing. Corn and soy are the two most widely grown genetically engineering crops in the United States today. The US does not currently require food manufacturers to label that foods that contain GMOs, but some products carry a non-GMO claim or seal to it. So corn and soy are the two things, yeah, most commonly. These are found in food and FDA, studies. Awesome, awesome. Any questions, anything you guys have, just shoot us anytime. Let's go next. Tips. Ooh, here, this is okay. So the next slide is going to be, I would say, one of the most beneficial slides in this presentation. What we're going to talk about is how to load up on produce. Choose whole grains versus none. Select meat carefully. We're going to talk about how do we do that. Follow the ingredients label as well. Limit packaged food when possible. And lastly, watch for hidden sugar, salt, and fat. We're going to talk about all those. And the primary principle of clean eating is to replace processed food with fresh food. So once we replace that process with fresh, we're on the good hands and whole foods whenever possible. The foods have not had anything added to them, like preservatives, sugar, artificial ingredients. Those are the foods that we're trying to get the most valuable out of, the most nutritional value as well. Awesome, awesome. Let's go next, please. Okay, I love that picture. That's what quarantine is all about. That's what you always do. You want to find your children, have fun with them, enjoy them, get them in the kitchen, load up on produce, teach them how to eat healthy. This is the time if for the next generation to learn and get that time that you can have with your family and with your children, especially being at home and working remotely. Those who are working remotely. I know Jared's in the office. He works with me, and most of our are in the office. But so let's just go back to it. So the first tip to load up on produce is, here's another question for you to see how much you know about USDA's recommendations and fruit and vegetables intake. So how much of your plate should be filled with fruits, vegetables, fruits and veggies in each meal? What percentage do you think? And give me start from 5, 10, 20, 25, go all the way up to 100. What does your plate include, and what do you think the recommended dose is? 50%. You're saying 50% of your plate, 75%. Okay, we're going up now, huh? Question mark, huh? Let me see. Cindy, Patricia, you both think 75. Okay, we're getting 3/4. 75, half. Kimberly, awesome. Cindy, 75. So Pat, Kimberly, half of your plate. Emily, also 50% is recommended. Emily, you're right. Pat, you're right. Kimberly, you're right. Absolutely. You guys got it nailed down. It is 50% of your plate contains of vegetables and fruits. 50. So if you have a circular plate, half of it should be that. What we usually see is half of it is usually carbs, rice, pasta, maybe 3/4 of it, 75% is that. And then the meat has about another portion. What we recommend, not what we, I mean, by the FDA and the whole diet, United States diet, and what they're recommending is 50%. That's the correct answer. So some of the most nutritious whole food includes fruits and veggies. one way to bring the focus back to the whole foods is to follow the dietary guidelines and to fill half of your plate with that nutrition, with fruits and vegetables. They're the most nutrient that we can get out of that plate. So according to the Center of Disease Control, that's in Atlanta, and Prevention, 76% of Americans do not eat enough fruits each day, and 87% do not eat enough vegetables. I mean, I don't know. When I was a kid, I hated vegetables. As I grew, I knew how important it is, and then I started eating more of it. And the more you eat out of it, then you start recommending it to our patients, and then they would listen and they would learn. And then the older our generation, grows, the more they're less likely to eat those unhealthy diet, and they're most likely to stick to their nutritional diet, which is very, very impressive. I like that how that percentage is going down. So fruits and vegetables are actually packed with nutrients. They may help reduce the risk of heart disease. Most importantly, obesity, type 2 diabetes, which is very, very common, and it's almost 1/3 or 1/4 of the population today here in the States. Believe it or not, even some of the cancers now, when they look at the antioxidants and they look at how to prevent that, it's actually ingrained in our diet. It's in the vegetables, it's in that fruits that we eat. So it's really recommended to eat it because of those health advantage that they have. You may be wondering if you need to choose organic options in general or organic foods, synthetic proceeds, engineered genes, fertilizers made from animal waste. There's a lot of talk in that, and we're not going to go in deep into that, but that's another discussion we can talk about. Why should we eat that? What's important in that? So the good rule of thumb is to focus on buying organic foods from the environmental working groups. Dirty Dozen list. There's an online list of this that talks about. This is an annually updated list of 12 foods that they say that can be contaminated with pesticide residue. We want to avoid another list called the Clean 15, which contains 15 foods that are less likely to be contaminated. And there's this link, I don't know if you can share with us, Jennifer, if you can copy and paste it here in the chat, where we can all look at that and choose my plate. It's a government website. It's where they talk about how your plate looks like, or what vegetables you want to include in that plate. That list of Dirty Dozen and Clean and 15, Clean 15. Also, if you refer to it, and you could send it so everyone could know what are the ones that we want to stick to, what are the ones that we want to avoid. So the website is choosemyplate.gov and then /myplate, or I see Jennifer's like typing it down there. Awesome. From 10 to regards to organic food, was that recorded, and where can we view it? I think that's a question to you, Jennifer.
Yes, it was recorded, and I'm going to get those posted to including today's webinar, and post that to Healthy St. Lucie. We've got it saved on our YouTube site right now, so I'll make sure you get a link to that.
All right, we'll go to the next slide. Great, thank you. Thank you very much, Jennifer. She's on top of it, amazing. Love it. Choose whole grains. So whole grains, according to Harvard School of Public Health, whole grains offer a complete package of health benefits. All whole grains kernels contains 3 parts, the brain, the germ, and the endosperm. Yeah. Disregard the screen. You got it. We don't want to see the Port St. Lucie files there. The brand, so there's 3 parts of those grains that we're looking for: the brain, the germ, and the endosperm. And each of these 3 parts boost health promotion nutrients. So the brain is the outer layer that is rich with fiber. It contains vitamins B, iron, copper, zinc, magnesium, antioxidants. The list goes on and on, just on that outside part. The germ is the core of the seed that is rich in healthy fats, vitamin E, other complex B vitamins, antioxidants, and also phytochemicals. The endosperm is the innermost layer that contains the carbs, protein, and small amounts of vitamin B as well as some minerals. So that's where it's a very small grain, but it contains so much nutrients that it just impacts really, really huge. In the 19th century, industrialized roller millers were invented, and which changed the way grains are processed. They started stripping out away the layers from each other, leaving only the endosperm, which is the inner layers, that resulted in a highly processed grain at a much lower nutrients profile. The Harvard School of Public Health also reports that the process strips away from half of wheat's of the vitamin B, 90% of vitamin E, and virtually all the fiber is all gone. So that's why it's so important to choose 100% whole grains over refined grains. Because what they do is they keep that central light, which is the best part, but it's the less nutrients versus the outer layers. The two outer layers have the most nutrients in it. So refined grains is not just stripped nutrients, they're also digested quickly, leading to sharp spike in blood sugar, because there's nothing that control that blood sugar in your body as much as the outer layers that kind of balance it out. Refined grains include white rice, bread, and pasta. We call them the three things that are not nice: bread, pasta, and rice. It's kind of like our nurses always say, they don't say it's not nice, they say we want to limit the intake of it to a certain amount instead of overindulging in those carbs. And processed breakfast cereals. Harvard School of Public Reports, Harvard Public Health reports, they talk about refined grains may increase your risk of weight gain, overeating, heart disease, and diabetes. So that refined grain versus whole grain, again, is what we're trying to focus on. So try to choose whole grains that have been the least processed. Grains like quinoa, brown or wild rice, farro, whole oats fit. All those fit the bill. Like there's a lot of good. And if you know any of the grains that you like, what's your favorite? Share with us here. What's your favorite whole grain that you like eating, that you would like to stick to, or you advise your family, your elder, your friends to take? And what do you take every morning? I mean, is it oatmeal? What kind of it is it? We want to know those kind of nutrition. How do we integrate this in our daily lives, in our daily food? Not just take it as a lecture versus how can we actually work with this and implement it in our life today? So whole wheat pasta, whole grain bread can also fit into a healthy diet, but look for options with a simple ingredient list. Love barley. Barley, yeah. We only eat brown rice or whole wheat bread. Those are two great options. We just talked about it. Wheat pasta, wheat grain is actually fit into a healthy diet, but look for options with a simple ingredient list. Remember, whole grains should always be the first ingredient listed. Sometimes the least processed breads in the grocery store are kept in the frozen food section. Never eat white products. Nice. Yeah, white products, I mean, they're good. They taste really delicious, but it comes with a little bit of a health check. All right, paleo diet. Says to avoid grains. Yeah, that's I don't know about I heard about that. I never, it's interesting. I know keto diet is another one. The keto diet these diets are a little bit, it goes into more detail and more in depth. Fair is becoming popular. Yes. Oh, we're getting a lot of, nice. We're learning a lot from each other here. I like it. And if you like what anyone else is saying, add it to your diet. Never heard of that. Awesome. You want to go next slide? Grains. Let's get out of the grains. Let's talk about the main topic. Let's talk about the elephant in the room. You know, the meat. No. If you're not vegetarian, this is, even though vegetarian are really that's really good. But you also have to moderate your, let's go straight to the selected meat. So some clean eaters avoid meat altogether and opt to follow a vegetarian and vegan lifestyle. They may make this choice based on a variety of factors, including their health, both physical and mental, and the environment, and their compassion towards animals. So there's multiple, when we talk to multiple, we have a doctor in our practice that's actually a vegetarian. Every time we discuss about this, she also includes why she loves it, what makes her. It's different from everyone else. Some people are, compassionate toward animals. Some people just like to keep their physical and mental well-being. Luckily, there are many great non-meat sources of protein. So even like eggs is really rich in protein. Nuts, beans, lentils, and if you think, I think avocado, right? No, avocado is fat, saturated fat. What other nutritions do you think that's really rich in protein that's not a meat in source origin? Beside eggs, nuts, beans, lentils. Let's hear from you guys, because this is very, very important to find your source of protein. Tofu, yes. Okay, I know you go to Whole Foods. Tofu is amazing and it's delicious. It's a protein substitute for, yes. So this makes it easy for people following, how many eggs weekly are we allowed before it raises your cholesterol? Good question. I don't know the answer to that. We'll have to get back to you on that. Would you be able, Jennifer, to look that up and help
Yeah,
with
I'm
that?
going to look that up now. I'm going
That's
to
a
try to
really
look
good
that
point.
up. Use phone.
Yeah. I really
There's
don't
a
know.
lot of controversy around eggs and cholesterol. And it may take longer than this call to figure that one out. But I'm
Okay.
going to do it right now.
All right. I like it. Egg whites, loves my eggs. Let's read this morning. 1 egg a day is okay. That rhymes. But let's go through the slide while, and I love that, that we're learning so much. I don't know things and we're learning as we go. So luckily there are just, we talked about those protein rich eggs, nuts, beans, and lentils. This makes it easier for people to following a vegetarian or a vegan diet, or for those just trying to cut back on meat to get the protein they need. The United States Department of Agriculture recommends about 56 to 46 grams of protein per day for men and women, respectively. So men should take about 56 grams of protein a day. Women should take 46 grams. Whatever that grams equals to, I think in meat, in eggs. Oh, wow.
Wow. Okay. Somebody's got, oh, sorry.
Emily just uploaded the whole FDA,
Wow.
everything, CDC, public health, Harvard. She put it all down there. Perfect. Thank you so much.
Emily.
However, do not, if you do not have to follow a vegan or vegetarian to eat clean, you may need to be more careful with selecting meat. First, try to stick with lean options like skinless turkey and chicken, lean beef and fish. Those are the best, I would say, if you want to stick to meat, try to stick to those, and those are your #1 options. Skinless turkey, chicken, lean beef, and fish. Next, if you want to choose what's on the next there, is choose options without antibiotics and or growth hormones. So when we go and we find that big chicken chest breast, or we find the big, there's a lot of growth hormone that has been introduced to those to get it to that size. So try to choose the ones that have no hormones. On beef, that means the producer has not used chemicals to make his or her cow grow more quickly. Hormones can be used in pork as well. That it kind of makes it makes a little bit bigger and makes the pig grow fast, and therefore they'll have more meat that they could sell in the market eventually. So if farmers can prove to the USDA that their animals are raised without antibiotics, then they're allowed to use the no antibiotic label, which is not very commonly used, but if you find it, that's also one of the top options in eating meat. Lastly, look for varieties that have lived and eaten as they would in the wild. So for example, not to cluster all the animals in one kind of place and have them grow together there, but have them wildly grown outside where they can eat the grass and grow normally. So minimally invasive process that contains no artificial ingredients is what recommended. However, if you ask me, I like that big steak, but hey.
In moderation, right?
In moderation, thank you. So I'll split that steak in half and, all right, so what is the
Am
list
I
of
right?
ingredients?
Okay.
What is that?
Is that the right slide, right?
You got it, yep.
Okay, great.
Combination of grains and beans and nuts gives plenty daily intake. Yes, if you combine them all, Edgar. Do you do that? I probably combine two of those or three max. I started using ground chicken breast and turkey in place of beef. Very good. It can be less expensive and less fat. You are absolutely right. White meat versus dark meat is actually another thing that we recommend when you try to fish, when you try to eat chicken and turkey versus it is less fat. Thank you very much for sharing that, Kimberly. Okay, so for the list of ingredients, so clean eating mainly emphasize whole fresh foods. We're always going to go back to that, fresh foods. These foods rarely have any ingredients list because they're actually as they are. They're packed from how they were harvested. It's not always possible to avoid packaged foods completely. In these cases, it helps to know what to look for. Reading the ingredients list is the only way to know what's in your food. Today, in today's world with COVID and everything, and it's not easy for us to go out every other day to go and get fresh vegetables. You know, that is what we recommend, but it's not really feasible in today's world. We want to limit ourselves and keep ourselves safe by going out as minimum as we need to the public area where there's a lot of people there and to get that. So even when you buy those packages, just make sure to read that label. Make sure that you look at the ingredients and what you want to purchase to stay on the healthy side. That's the trick right now. I know it's hard, but also your safety is more important right now as well. So try to find that right. To start understand that the ingredients are listed in order of quantity. For example, if a jar of spaghetti sauce lists tomatoes as their first ingredients, you know right there that there are more tomatoes in the sauce than anything else. But if they include something else on the top, they usually top what's the most ingredient in there, and they go as they have less amounts in that. Next, when you look for ingredients, you recognize, always ask yourself, what is this food? You may also want to look for labels like free of artificial dyes and flavors or preservative free. Those are the ones if you find it, that's a grabber. In addition, try to choose foods that have a short ingredient list. Some experts recommend choosing foods with 5 or less ingredients. You do not have to make it complicated. Simply try to choose foods with a few ingredients as possible. Finally, do not assume a food that's labeled low sodium or sugar free or 0 trans fat. They fool you into thinking the food is made with high quality ingredients. Oftentimes, these processed foods are loaded with additives and preservatives. So sometimes like a 0 diet, what is it? A Coke, I drink that. I'm guilty. But you know, they do have, they will say 0 sugar on it, you know. But if you really look, there is actually other substance of sugar alternatives, and that is also not healthy. So we have to look at what are we putting in our body? How much are we putting in it? Are we drinking a large can, a 2 liter, or is it the tiny ones that you take a sip and you're like, just have that, you know? Yeah, awesome. American Heart Association. Emily shared with us Health Heart or Smart Basic Understanding Ingredients on Food Labels. Oh, thank you so much. So this is this link is very helpful actually. Thank you, Emily. This link could help you understand when you go to that store and read that label, what to look for and how to find it. Thank you so much for sharing. Yeah, I like this. It's a highly intellectual group here we have. Very interesting. Okay, let's go next. Thank you. Limit packaged foods when possible. As much as you can, try to limit it. We're going to take a few steps here. So as you have already learned, insofar as what we talked about, a major component of clean eating healthy is limiting the processed food, packaged foods. For many Americans, this major change is current eating habits. What we look for here, let me ask this last question here, and let's see who gets it right. What percentage of food calories purchased in the United States come from moderately or highly processed foods? Let me ask that question again. What percentage of food calories purchased in the United States come from moderately and highly processed foods? So your daily intake of calories, how much do you think that percentage of calories that you daily intake is coming from processed food? Is it 5%, 80%? Edgar, limited down, 40%. Okay. Emily, I'm going with a lot. Well, you could be right, 40%. Pat and Cindy. Pat and Cindy always match their numbers. So actually, to be honest, Edgar is very, very close to correct. It's 75%.
Yeah, that's
I thought you
scary.
guys work together.
Yeah.
Yes. So it's actually 75%. It is very high, Emily. Yes, you're right. 75%. It is scary. And that's national average. That's in the United. We're talking, this is where we're at today. If we go back 100 years ago, that percentage would have been so different. But in today's world, in today's lifestyle, how we're living, believe it or not, 75% of your daily calories is coming from processed food. It came out in 2015. A study published by American Journal of Clinical Nutrition reported that more than 75% of calories purchased come from moderately and highly processed foods. This is problematic because processed foods generally contain higher amounts of fat, salt, and sugar than whole foods or homemade versions. So when shopping, create a strategy for navigating the supermarket nowadays. Fast foods and a lot of eating out. Yeah, I'm trying to cut down on that. But hey, as much as you can. So when you shop and go into that market, try to navigate your way through the store. Hey, I want to go to the healthy section. I want to go to the produce section. I want to fill in my area with this before going into the can section and just dumping everything in that cart. Just make sure when you go shopping, shop smart, and try to use the aisles where packaged foods and all those are less taken. You can also look for opportunities to make sure that your own versions of processed packaged foods are, for example, you can make your own salad dressings, hummus sauce, breads, granola bars, sweet treats. Be sure to look for healthy recipes with simple ingredients is one of your best options. And that's your best takeaway, actually. Yeah, let's go to the next slide, please. Awesome. So lastly, important thing is sugar, sodium, and fats. I want to limit this really quick. So sugar in your diet, there's two ways that you can have sugar. You can even have, they divide sugar into two different things. Natural sugar, which you get from your fruits, your vegetables, your milk, your this and that. And that's the natural ones. And there's the unnatural ones where you kind of get it from your candy. You kind of get it from chocolate, from where else? Even your sodas and diets, right? All those are unnatural. Stick to walking outside of the aisle. More processed foods are throughout the aisles. You're right. So just go around the aisles and just get your produce, milk, and things and walk out. So try to limit that sugar intake to like the natural sources versus the not natural sources, right? And then sodium. Watch out for your sodium. Compare labels when you're any of the packaged food you're purchasing. Select the product with the lowest amount of sodium in your serving. So try to look for what preservatives on there. How can you avoid it? And try to eat less of the cereals, waffles, cookies, cakes, pies, all those nice things, ice creams. Those kind of, you want to limit it as much as you can but what American Heart Association says, 90% of Americans consumes too much sodium. They say that on average, Americans are currently consuming 3,400 milligrams of sodium daily. It's about that's about 1.5 teaspoons of salt. And then what they recommend, is that you eat no more than 2,300 milligrams of sodium daily, which is almost about 1 teaspoon of salt a day. So we're about 1.5 more than what is recommended. What is the maximum recommendation? So if we try to keep down on the sodium, that'll be great, especially for those who have hypertension or blood pressure disease. It might increase it, especially if you have family risk factors. Synthetic fats. Lastly, let's talk about synthetic fat. These fats are created in the industrial process that adds hydrogen to liquid vegetable oils to make them more solid. These fats are easy to use, inexpensive, and they last a long time. All right, next, please. Any questions so far about this, guys? If you have any questions, just let us know. Unmute yourself, ask us. We're almost done. This is our last slide. Excited. Long meeting today. Other ways to live clean. So in addition to your diet, you might want to consider cleaning up other areas of your health and well-being. Beside the diet, we always link these two together, diet and exercise. Being physically active, taking a walk, even maybe while you're in their store, just walk circles around the aisles. If you feel like it's an air-conditioned place to do it, you might as well, and instead of lifting heavy weights, you're actually pushing that heavy cart, right? I'm just making that up. But what I'm saying is try to be physically active. Try to walk out 30 minutes a day, 3 times, 4 times a day. We encourage patients to do that and try to get their heart rate a little bit higher. So find activities that you enjoy, you like. Snorkeling, is it going to the pool? Is it walking outside? Is it finding your neighbor, making sure that they're COVID negative and then walking out with them and doing that, doing a nice walk with your partner, with your significant other, with your family, with your friends, play with your dog, go to the dog park, walk with them. Get plenty of sleep is another one. You have to importantly is get enough sleep right now. Sleep, I can't emphasize how important it is. We try to practice as much as 8 is healthy, 7 is good, 7 to 8 is good. Don't overindulge yourself over 10, not because it's healthy, just oversleep yourself because you're only going to get tired more the more you sleep after 10 hours. Connect with others. This is a time, especially now with everything what's going on, depression and anxiety, loneliness is a big thing. We're talking to our patients on a daily basis, telling them connect with your loved ones, reach out to your friends, reach out to your family. Even if you had a fight with someone, this is the time to make up and get back into that true feeling. Have people that love and care about you, reconnect with them. They'll rejoy your life. They'll get you out of loneliness, depression. With nowadays, I mean, thanks to virtual, look, we're having a meeting right now and we're all not sitting in the same room. We didn't travel hours to go somewhere. We're sitting in our own comfort of our offices, of our homes. They could do that. You could do that. We recommend patients to do that today. Zoom is an application, whatever application you would like to use, FaceTime, however it is. The digital word is now to reconnect, laugh, play a game, make a joke. Yep, that's about it. And don't forget to eat healthy. So let's review everything, guys. Just to go over a few topics we talked about. Clean eating does not mean like eating everything clean, or that means other foods are dirty. It all means about going back to the labeling and eating things where they're originally from. Instead of clean eating as a way to become more aware of what's the food are you eating in, just make sure that the nutritionist options that you're choosing is actually less additives, less preservatives. We don't want to go over a lot of additive nutrition to that. It's important to emphasize that moderation is key. Moderation is really the key. Sometimes that plate, when I say 50% veggies and fruits, that doesn't mean get a huge plate to fill it up with 50% of veggies and then you have a lot of other stuff. So the idea is to moderate that plate. Start by talking to your health provider about what making some small changes like the ones we discussed. Fill your cart with produce to start filling up half of your plate and fruits, half of your plate with fruits and vegetables. Replace refined with with whole grains. So you want to include all those outside part that has most of the nutrients. Consider replacing some of the meat in your diet with non-meat sources of protein or non-antibiotic and small plate is a great strategy, absolutely. So look at your ingredients of your foods, and Emily shared with us on how to look for those ingredients. What you want to include and what you don't want to include in your ingredients is very important. The sodium amount, the top to the bottom, look for what's most abundant in that, what you're purchasing all the way to the bottom. Limit packaged foods. Try to avoid walking in those aisles where package and cans and foods are there. Try to eat as much healthy as you can during what's going on. And always compare your nutrition facts labels to what amounts of sugar, salt, and fat is in there. And stay healthy, eat healthy, exercise healthy, connect with your loved ones. And yeah, thank you so much for giving me this opportunity. I spoke too long. I do apologize, everyone, but.
No, there was a lot of content to cover, and it was great content, though, and there was some great feedback on the chat box. So that was a lot to cover, but a lot of stuff to think about, too, and how we can really improve. I'm going to just kind of leave these references up here right now. Do you all have any other chat questions or comments in here for Dr. Bizanti? And we also had a reference page as well. All right, well, thank you so much for coming. I did want to give a little pitch to our next webinar coming up on October 29th. Humana will be here to bring us the habits of healthy people. The webinar will be on the same link that you've used today. It'll be from 10 a.m. to 11 a.m. We'd love to have you there. We'd love for you to share this with your friends, your neighbors, co-workers, anybody else that you think would benefit from hearing content from these presentations. That would be great. And if you'd like to be notified of future trainings, work that we're doing on the Community Health Assessment and Community Health Improvement Plan, or maybe you want to join one of our work groups, we would love to have you on board with us. You can email me at jennifer.harris@flhealth.gov. And don't forget to follow us on social media as well. Any other questions? Can you go back a few slides to the list of the websites? Yes, ma'am. There we go. So again, I'd love to thank Primary Care Associates and Dr. Bizanti for being on the call today. Phenomenal presentation, a lot of content covered, a lot of new things to think about and take home, and hopefully we can start revamping our plate at home and making sure we've got more fresh fruits and vegetables on there, and cleaner food, and that we can start moving forward with better health. And any other questions? Oh, so you love the interaction of the approach. I do too. I really love the surveys, and I want to look at how we can start incorporating that type of method in many of our other presentations we're doing. It was great. So, all right, so we'll go ahead and conclude this call today. Oh, where's the doctor's office located? I don't know if Jared or Dr. Bizanti want to talk about, I know you all have multiple locations. Are you guys still on?
Yeah.
There we go. We had a question in the chat box about where you all are located, your doctor's offices. Specifically in St. Lucie County.
Yeah, we have. We have actually four offices spread out throughout the Port St. Lucie County. We have one in Port St. Lucie East County, one in West. We have two in Stewart's. Jared, is it okay if you can help me put in the addresses for our offices and locations so everyone could know and they could come and swing by, look at our providers every day they're going in there working, and yeah, we would love to share that. Yeah, absolutely.
Perfect.
And you guys are more than welcome to come in and see what kind of pamphlets we have, educational leaflets that we have in regards to chronic conditions or diet or nutrition today. Oh, he just put our website. Our website is right there.
That's
Thank you
perfect.
so much. It has all the providers that are in there, the addresses, and for all our offices. Yeah,
Great.
we're very
All
happy
right.
to
Well,
help as much as we can.
yeah, great. And we'll put that on our, I know we have you all on our website, but we'll try to make that link to the medical centers that are available on there as well. There's Jared. Okay, Hillmore Drive, Suite 500. All right. Well, thank you everyone for joining today. We hope to see you on October 29th as we look at habits of healthy living. Hope you have a great rest of your week. Thanks so much.